Okay, so for the intramuscular medication administration, you would get your prepared medication, take it into the patient's room. You would check the provider's orders, and then check your patient with their name, date of birth, compare it to the MAR. Check their ID band, scan the ID band. Then you will check their information, perform hand hygiene and don gloves. And then you would find out which site, which area you want to give the okay, we're just gonna leave it like that, and I'll just pick this up when I'm gonna give the injection. So like I said, you're gonna want to identify the sites, which I believe there are 3 major sites that you can give intramusculars in. The first one is the ventrogluteal, and the second one is going to be your vastus lateralis, and then the third one is going to be your deltoid, which I explained the deltoid in the video before. So the deltoid is going to be you're going to be exposing their upper arm and shoulder area. And then on the ventrogluteal, which is like your gluteal area, you want to use the V method, which means you're going to position, you're going to have the patient either lie supine or lateral, and you're going to have them with their knee and hip flex, so that muscle right there is relaxed, so it's easier to give the injection in that spot. And then with your vastus lateralis, the V, sorry, let me go back to the V method. So you're gonna have them laying on their side, and then you're gonna have them, okay, so then you're gonna have them like flex, I just went blank. If I could stand up and show you, it'd be easier, but I'm just gonna leave it like that. I'm gonna ask them to bend their hip and their knee, so like bend it, flex it to relax that muscle, and then place the palm of your hand over the greater I don't know how to say that word, but it's like cantor or something, and then of the hip, and then your wrist is going to be perpendicular to the femur. So put your palm of your hand, and then your wrist is going to be perpendicular to the femur, and then you're going to move the thumb towards the patient's groin, and then your inner finger toward the anterior superior line. So yeah, and then extend your middle finger back along the iliac crest toward the patient's buttock, and that should form your V. And then your injection site is going to be the center of the V for the ventrogluteal, and then for the other, the vastus latius is going to be the anterior aspect of the thigh. So that extends on the adult. It's one hand above the knee to one hand below the greater transtor of the femur. So you're looking at a hand above your knee and a hand right here, and it's going to be that inner space in between both of those. And then the other one is the deltoid. So like I said, you'll expose the person's upper arm and shoulder, and then you'll ask them to like remove, and you'll ask them to relax the arm. And then, yes, so it's going to be like right in that area. So then you will grab your syringe, and actually you're going to have to clean the site first. So in the outward motion, clean it towards the outward motion. And then, okay, so you allow it to dry. You're going to remove the cap. Then you want to spread the skin tightly with your thumb and forefinger with your non-dominant hand. And then you're going to inject the needle at a 90-degree angle. So straight forward like this. So, so then you straight forward in there. And then once you have it stable, well, I'm going to have to put it like that, but you grab your non-dominant hand and you plunge the syringe in like that with your non-dominant hand. And then you'd slowly pull the syringe backwards a little. Again, you would be doing this with your non-dominant hand. And you'd make sure that there's no blood or anything. You'd aspirate the needle and you'd pull back just to see if there's any you just aspirate it, and then if there's blood, then you remove the needle and then dispose of the medication, and then you just do it over, you would just do it, repeat the medication administration again one more time, or as many times, you know, as needed if there is blood. Then you want to withdraw the needle, and then use your scoop method here. Well, you still can't see it. Use the scoop method, scoop it in like that, like so. And then you push it back, and then you would dispose of this. And then if there's any leakage, which my thing has been through a lot today, you just wipe and just hold it there if there's anything leaking, and just, it's gentle pressure. You don't want to push too hard at all. Also, I forgot to mention that whatever area you decide to do, you need to make sure that it's free of any bumps, redness, swelling, any irritation, because you don't want to cause further pain to the patient. So then after that, you would discard of the syringe, and then you would check with the patient, make sure that they're just to make sure that they're handling the medication well, they're not having any different reactions. Then you want to document everything, the time of administration, the administration, the dosage, the route, the time, when it was administered, and then if the patient has any reactions, of course, you'd want to document all those findings. And I think that's it.